how bodybuilders die. This is going to be a very relevant video for today's times. The date today is October 8th, 2021. I want to bring this to you guys because we've seen in the last year in this specialized fitness community, no one's going to argue that there's been some deaths, some untimely deaths. And I want to bring to you guys a scientific perspective on what may happen and how a bodybuilder, let's be clear here guys, that's using performance enhancing drugs, very complicated. Forget who's giving it to him, himself, the guru, the coach. I'm not into that right now. That's not the focus on this. And for some people, we certainly don't know the details. We could wait for autopsy reports to come out, certainly. And even then, sometimes the autopsy reports are not clear, right? Like Rich Piana, unclear. You could see that video. Dallas McCarver, it was more clear. But as a medical physician, I want to bring to you guys who really love the technology. So this is technology. This is super, super, super complicated. And as an internal medicine doctor, I could really get a grasp for this. I could really get a grasp for this, but I certainly don't know everything. But this is my perspective of how bodybuilders, obviously that use drugs, chronic drugs, acute drugs to perform. It's not just steroids anymore. This is super complicated. So hope you guys agree with this as far as my perspective that it's not putting blame on anyone specifically and not pointing any fingers, because in the end of the day, it's you. It's your body, and you're going to take a different level and a spectrum of drugs, for health even, and their side effects. So it's a very modern world, guys, and drugs are important. They work. Of course they're going to have side effects. This incredible world of sports, from pro sports and NFL and Major League Baseball and hockey, and I've dealt with some of these guys, right? Very tricky, very, very well monitored, still can get by things. How do they do it? I mean, NASCAR guys have to be drug tested, right? For more neurologic drugs. You gotta focus, gotta think, amphetamines and things, right down to other drugs. And even guys that target practice and shoot guns are gonna be on beta blockers, and that's illegal. So this is incredible. I'm a drug guy, I'm a medicine man. So let's get into this, guys. It's really, really cool. Here's how I break it down, guys. Bodybuilders die. We got to look at two scenarios, two venues, acute death versus chronic death. This stuff is kind of more sleepy and kind of doesn't make news, and no one really cares. I'm just joking. Of course people care. This is what I see. Guys in his 40s to 60s, he's used steroids for years. This is the stuff we see. Hold on. Let's hold off on that. Now, the acute stuff. So when you find someone before a bodybuilding show or after a bodybuilding show or a powerlifting show or any kind of show at all, where they're using these drugs and they're doing extreme dieting and all these things together, let's look. This is acute. Okay, acute death. You're going to really look at two types of acute death, right? So, hey guys, quick pause here. If you're watching this video, odds are you're concerned about your testosterone levels. That's where the sponsor of this video comes in. Let'sGetChecked.com. Let's Get Checked makes professional health testing easy by letting you get tested without having to visit a healthcare provider. Choose your test online, like one of their testosterone panels, and it will be delivered to you in discreet packaging with next day delivery. Once your sample arrives in a laboratory, confidential results will be available from your secure online account within 2 to 5 days. See my link in the description for more details and discount code. We look at two types of acute death, right? So it's the heart's gonna stop, right? It's not from cancer. It's how does the heart stop? Guys, this is called cardiac arrest. So someone's heart stops. I'm gonna go into the top stuff here, relevant Not for like the emergency room guy, but the ER doctor. These are all my buddies. I love these guys. I work with them all the time, unfortunately. So they have to take it from this perspective as well, but it's going to be different from this perspective of how a bodybuilder is found dead either before a show or after a show. I don't know, have guys died like on the stage? I'm sure it's happened, but it doesn't really I haven't really heard that really, funny enough. Dallas McCarver, he fell. He had a near sinkable event and he got dizzy and they grabbed him before he fell. And subsequently, months later, he died, and that was very complicated. So, but these things still apply. Same things apply here. So, cardiac arrest. Let's go right into it for you guys because I want to make this really interesting for you guys. Put the thinking caps on. So, diuretics. Let's get right into it, guys. I don't care who's giving it to them. They're given or they're taking diuretics. Very complicated. There's K. That's potassium up and down, not just potassium sparing, guys, which is spironolactone and triamptorine. These are well utilized, heavily utilized. They make that hard, dry look unbelievable. Not that they're not training hard and not eating properly, but this stuff is used very high dose. I can't believe the doses I'm hearing and seeing over the last 5 years. And the pros agree with me. You see pro bodybuilders that are retired, they're criticizing this stuff right now. So this is the big money right there. Yes, it is diuretics. Let's talk about them. There's potassium sparing, which means the mechanisms in the kidney is that they're going to increase potassium inside the blood. Your heart is the basis for, it's an electrical system, guys. Very complicated. Diuretics are going to affect that. It's not just these potassium sparing, spironolactone and triamptorine. There are several other ones, guys, but those are big. Those are big. They're utilized with other drugs that are classic. Lasix, that's not potassium sparing. That's why, oh my God, do they know these mechanisms? It's so complicated. And I think the gurus think they know the mechanisms and they're playing games with it. No comment. So Lasix, that dumps potassium. That's furosemide. That's a loop diuretic. That's going to dump potassium. When you work as a doctor in hospitals with little old ladies and you're using some of these drugs for heart failure and both of these different drugs, you're looking at check the K with the nurse, give potassium back or back off it or remove the potassium. This is deadly stuff in the ER, guys, with cardiac arrest, diuretics. What the drugs again, and then this is, guys, it's polypharmacy, it's multifactorial. Those are my words. I love you guys because you guys talk to me and you always bring it up, doc, everything's multifactorial. Right. Drugs, anabolic androgenic steroids, obviously is the base. Do they directly cause acute cardiac arrest? No, itself. But what's going on? Do you have unstable plaque? Getting back to the drugs, if you're on an ACE, and this is why you can't just take these drugs all at the same time. Doc, treat the hypertension with an ACE inhibitor or an ARB like Losar, and then potassium goes up. And then if you're on a potassium sparing, this is what's happening, I assume, because they're trying to use these different drugs, but they're not understanding the implications and how complex they are from minute to minute, hour to hour with different IVs. Guys, they're dehydrating. Even, I love powerlifters. This is bodybuilders. They water load and they dump their weight. These guys within 24 hours can lose 20 pounds or more. Guys, I'll do a video on that with the powerlifters. You don't think that's affecting your electrolytes? I mean, you're young and healthy. You just have palpitations and throw up, whatever. You're using drugs on top of it. So the diuretics are potassium sparing, increased potassium, sudden cardiac death, cardiac arrest. It works via arrhythmias, guys, but I kind of put that down there. This is all comprehensive. I know you guys love this stuff. This is real internal medicine, guys, on performance enhancing drugs. So there's the steroids, anabolic androgenic steroids. That's on top of it all. So they have an effect. And do they worsen the heart disease and you have unstable plaque? Guys, the guy dies or the woman dies because the moons line up. It's very rare. Thank God it's rare. It seems like it's happening more often. What's really playing the role? You can't just say one thing, but if I have to weight this, if I have to give a priority, boom, it's the diet. He doesn't talk about the diuretics. I'm talking about the diuretics now, guys. Focus. So drugs on top of it, on top of diuretics, using IV fluids, cranking. So these guys, again, you guys, some of these guys are playing games, and then they throw in the IV fluid. They're going to get the IV fluid. If you have a bag of IV fluid with potassium, they think that's the way to go sometimes. I'm not, guys, I'm the consult. I get all the consults. Yeah, I'm trying not to get emotional and pissed off. I see it, and I work with emergency room doctors. If the guys, so this happens all the time, they go to the ER, thank God they're not dead, hopefully they didn't have any severe disability. When you're on these other drugs that can be great, that I'm on and I talk about it, and it's great to protect the heart, if you're in this acute phase of using these other drugs, there's interactions. So that's it right there, the IV, and then IV fluids, and the effects on the potassium. Not just up, but you can deplete potassium and die and cause an arrhythmia, guys. Electrolytes. Are they checking the electrolytes? Should we check electrolytes? Like right before the show, you're going to see, the medical guys are going to come in on this. The IFBB, they're coming down on this, guys. They have no choice. Liability's going up. It's going up. Liability's going up. Ephedrine. Again, these are these cutting drugs, right? Forget the Winstraw and all the other drugs. I'm not a guru. I know the drugs. I just see the end result as a physician. Ephedrine, the fluids, the up fluids, the down fluids, the potassium with the fluids, not with the fluids. Oh my Lord. And some nurses and some, I don't think too many doctors, but there's a lot of nurses and EMTs and stuff that are getting involved with this, trying to help people. Be careful. I hear this all the time. Now, myocardial infarction, unstable plaque. If you're in this scenario and you're 37 years old and maybe your family history is something where you have plaque already, it happens at 37. It's quiet. And you're playing with this stuff, could you have a heart attack? Heart attacks, for the emergency room doctor that will look at this, for the acute, how does a regular person die? This is going to be MIs up front. MIs up front, that's unstable plaque. Again, that's my work with calcium scores and lipids and family history and all the vital signs, blood pressure, diabetes. Come on, guys. But, okay, so the diuretics and the destabilization of the electrolytes, mainly potassium, leading to a dangerous arrhythmia. Watch the arrhythmia, guys. I know you guys love this stuff. I've thought about it. I really love making this board here. So, arrhythmia, TSADS, polymorphic VT, and then ventricular fibrillation. That's, in the end, cardiac arrest. It's ventricular tachycardia, the heart, the electrolytes, the potassium, the sodium, the wounds line up, there's anoxic damage, there's an acute blockage from an unstable plaque, the wounds line up, the potassium, there's maybe some chronic kidney disease, acute renal failure, it all happens, the heart gets stunned, it goes through, the ventricle can't pump, it pumps faster and faster and faster, it goes into this polymorphic VT, ventricular fibrillation, you're dead. You're dead. You're dying. You don't circulate blood long enough, anoxic brain injury, you're dead. The paramedics come on the scene, the EMT guys, God bless you guys. Oh, they can't pay you guys enough. They come on the scene, and boy, EMT guys, you guys rock. You know exactly what I'm talking about right here. Especially paramedics. You guys, this is your life. Thank you. So they come on the scene and they make a quick assessments, ABCs, airway, breathing, right? And they get the defibrillator right on board, and they make assessments, and they try to break that rhythm, and they try to bring that person back. Sometimes if they get there soon enough, it works. And then they start playing with the potassium. They start playing with electrolytes. That's called running a code, guys. Those paramedics, they're doing that right there, right in the field. Unbelievable. But if you get there too late, it's too late, guys. It's too late. The body's fragile. This is fragile chemistry right here. Decides polymorphic VT, it runs to ventricular fibrillation. That's it. Now, the next piece is congenitally. If you have congenital, that's just like inborn thing you have. So that's hypertrophic cardiomyopathy. So on top of all this, that's how those big famous basketball players, that are young in college and stuff, back in the 80s and 90s and stuff, they died. Boom, dead. Athlete dies on the soccer field. Hypertrophic cardiac, it's a cardiac arrest. It's not from diuretics, probably not a heart attack. An arrhythmia of what type? There's other types, Wolff-Parkinson White, there's other types of congenital arrhythmias. I kind of left that out here. It's really interesting, this hypertrophic cardiomyopathy. You could get ECG, you can get echoes. Matter of fact, I was a doctor for some NCAA guys, no names mentioned, up in Connecticut, where the NCAA requires ECG and echocardiography. Very interesting, kind of like an executive physical. Why wouldn't you guys get this stuff? Sure, because you want to see that left ventricle. And I'm not a cardiologist, guys. It's very straightforward, though. Why wouldn't you get that? Maybe you have a little bit of that. Now it's not just like it's so clear. This can come on later on. I just read an article about this. This hypertrophic stuff can come on later in age. And when you're on androgens, forget all the diuretics, because I've never done diuretics, and most powerlifters and regular dudes don't do diuretics. They just do some steroids. And what is that going to cause? Myocardial infarction, potentially. Not everyone, but heart disease and heart failure, and then chronic kidney disease, and then depression. So that's the chronic, guys. No one really cares about this. We care about this, right? But I care about that. And then, so on top of this congenital stuff, guys, that's the physical function of the heart that you're inborn with that you just don't know because you haven't checked. That's where the moons line up. Now, next, chronic kidney disease, acute renal failure. On top of all this works with the potassium and the arrhythmias again. If the guy's 37 and he's been on steroids for years and he has genetics for focal segmental glomerular sclerosis, and he doesn't know, and his creatinine, I mean, again, you should look all this stuff, but the creatinine's up because he's dehydrated and he's got muscle tissue. But does he have chronic kidney disease on top of, then he has acute renal, he presents with acute renal episode, hypertensive or hypotensive. This is emergency room medicine. This is really for the ER doc. And thank you so much. So many ER guys work with me and send me patients, and I appreciate you guys so much. That I certainly don't know everything, but this is heavy duty stuff, and I really hope that you guys appreciate this, and I hope I did it right. So then, after all the interplay here, I call it sundry drugs, miscellaneous drugs. So I want to make sure it's everything. You got the T4, T3, the cytokine, you got the thyroid preps, because that's the prep. This is a prep stage. This is the prep stage, living in the prep stage. So DNP, how can I not have DNP in here? But you don't die acutely probably from DNP. You're on DNP, you're going to die because you're heating up. You're going up to 104, 105, 6, 7 degrees. You're not hanging out, hey, what's going on, John? Boom, boom, boom. You're feeling like shit. You're passing out, you're sweating, you're burning up, you're going to the ER. DNP, causing acute cardiac arrest? No. On board, worsening everything else on here? Potentially. Next, Clenbuterol. Beta-adrenergic agonist. It's a asthma medicine. It's going to affect, it burns. It's a burning drug. On top of all this stuff, can it destabilize plaque, cause arrhythmia? Hell yeah! You go to the ER from this stuff, Clenbuterol, and then I throw GH in there. Because I got to throw the GH, because on top of all this stuff, you got tons of growth hormone in there. That's not known to do anything up here and this stuff here, but it's just in the mix. Let's go, guys. This is cardiac arrest. This is why, mainly, I assume that these people die in the post period acutely, and they're young, and there was nothing wrong with them. Yes, it's drug related, guys. On top of congenital, on top of the whole scenario, the moons line up. It's rare, thank God. We need to make it more rare. But I'm not going to politics, guys. I don't need to hate anymore. Look, next, VTE, venous thromboembolism. This is a DVT, deep venous thrombosis, usually in the lower limbs, goes up, pulmonary embolism. This is also how you see people go to sleep and they just don't wake up. They have a PE. What is it from, guys? Genes. There's a lot of genetics on it. That's why family history, guys. FH, family history, get it done. You can see it, and then you're putting it on some of these drugs. Androgens, Even estrogens and oral contraceptive and HRT for women can cause PEs and DVTs. Androgens, number one with genes, AIE. What do you guys think that is? Androgen-induced erythrocytosis, the red blood cells. It's a hypercoagulable state, guys. That's why we don't like those red blood cells up when you're on testosterone, and I love all you guys, and myself even. You look at, what is it from? Sleep apnea, what do? Lower it? Do you phlebotomize? I have videos on this. What's the risk in the end, doctor? What's the risk? I like those red blood cells. What's the risk of that? I feel fine. We don't really know. DVT and PE, and maybe even destabilizing an arrhythmia and causing myocardial infarction. We don't know, but it's true, potentially DVT. There's data for this, guys. It's scanty data, and there's no direct line from A to B to C, just not there. That's why I'm working on stuff. Cytokines. I add cytokines because when you look for other inflammatory markers, and this is my COVID. Like that's cytokine, that's COVID. Okay? So he died from COVID. Okay. Maybe he did. So on top of everything else, he had COVID. Guys, moons, see them line up. That's life and death, potentially. Really, it really can be. Travel. If you have a DVT, you get off a plane. Maybe he got off a plane. He was on a plane. He was on some of these drugs. He was otherwise doing great. But he had a DVT. And it came up. And it caused a deadly saddle emboli. It's called in the pulmonary emboli. Boom, dead. PE. I want to make sure I get this right for you guys. Acute cardiac arrest, pulmonary embolism, VT, venous thromboembolism, acute death. This is emergency room stuff, guys. This is what they do. They look at aneurysms. They look at other things too. But this is kind of, it could have had an aneurysm. That person died from an aneurysm or an aortic dissection, from hypertension. That's in here too. Who knows? These are I believe, more common. Immobilization. So if you're traveling and you're immobilized, if your foot is injured, you can put a cast on it. You get a DVT. I see it all the time. Guys, medical. This is internal medicine. I see DVTs all the time. You have a travel history. You're in the plane. You got a family history. You got your hypercoagulable state. You got the cytokines. All this stuff. You got a DVT. Boom. Potential. We got to give anticoagulation medicines, right? So heparin and all this kind of stuff. We're giving Lovenox. We give all these different drugs, right? So we got to look at that. I have guys all the time that have histories of DVTs. And it is androgens and testosterone even playing a role on that. I have to always work with hematology doctors, pulmonary doctors, primary care doctors. So, that's it, guys. That's the acute, the cardiac arrest, complicated, and then the PE from a DVT that with the genes, the androgens, and less of the stuff above, more of the stuff down below here. Next, acute chronic. Who cares, right? Guy's old man. Did steroids for years. He's dead. He's in his 50s. That's probably too young. He's in his 70s, 80s. No one cares. I'm just being a funny wise ass. So the death from bodybuilders that die is because they don't die here. They get through all this. Now they have heart disease because they're a regular person. And they have heart failure. It's a regular person. They have myocardial infarction, chronic kidney disease, and then I have to put depression in because this is just a vicious cycle. This is just a sad vicious cycle, not even to do with anything with steroids, just people. But it's true though, guys, that if you do steroids and testosterone, even me, I have to worry about this. This is why I became the man who I am and the doctor I am for you guys. That coronary artery disease can develop, it develops anyway as you get older. Is it on steroids? This is what I'm doing for you guys. This is over now. Is it going to be a chronic death and die early and suffer with a poor quality of life because you're exhausted, and not to mention erectile dysfunction and all this stuff, myocardial infarction, chronic kidney disease superimposed on CAD, heart failure, and then of course this whole depression. This is not a nice life. You don't have to have it, guys. If you super focus on all the stuff I'm trying to help you with early in life, I can't support all this kind of stuff. With some testosterone if you need it, and ease it down and focus on this, guys. If you're going to do this stuff, be very careful. Don't let anyone give you drugs that you don't fully understand, regardless of how good the people around them look. Thank you very much. CBC, that's the red cells. Comprehensive metabolic. Woo! You're going to see that they're going to require this now for these shows. It's going to have to happen. Electrolytes right there. That's the potassium. Right in there, guys. Kidney function, liver function. And you know, no one's dying here from acute liver failure. That's not up here. Kidneys in there. Heart's in there. Urinalysis. You do it early. You're pissing protein, guys. That's not right. You got to see a nephrologist. Lipids. That's the heart stuff again. Family history. Blood clots. A lot of guys, come on. People have it. It's common. Factor 5. Very common. Family history. You got to do it, guys. What else? In that a resting 12-lead ECG for most of the stuff is going to be useless. I know they're going to want to say it. They recommend it for pre-ops, and now there's really no data for it. I'm just telling you the truth, guys. I'm a doc. I'm an internist. I've done thousands of pre-ops, pre-operative exams. I've cleared people for the OR. I'm just telling you, asymptomatic ECG, cardiology guys, you're going to agree with me. I mean, if you have hyperkalemia, you're going to see the peak T waves. Yeah, that's a no-brainer, okay? And I know guys tell me this all day long. Great. But, I mean, what do you do then? Like, you know, get the IV going? Or don't put potassium in it. Echocardiogram. Hypertrophic. Early heart failure. Come on, guys. This is cool stuff here. The calcium score, my calcium score. We're out of the acute stuff now. Coronary artery calcium score. Really, really important stuff. Tells you if you have any plaque in here, unstable plaque, you'll see chronic plaque first. Guys, you're in your 30s. Get it done. What's the worst case scenario? You spent $99 and it's a zero? Don't let anyone talk you out of it. Don't let anyone talk you out of this. It's not going to hurt you with radiation. It's $99. Your insurance is not going to pay for it. Get it done. It's no radiation. It's equal to a mammogram. Guys, this is it. Hope you guys really liked it. I want to get tons of comments. Explode the comments. I mean, I try to stay out of the politics on this, guys, until we have some more data out down the road. But, I mean, I had to do something for you guys. I really hope you guys appreciate it. And I hope this helps one guy, if not a million guys, to really understand that you're playing with performance enhancement drugs, man. Woo! Yeah, you'll look great, maybe, but it's complicated. Thank God it's rare, super rare. Thank you so much, guys.